Good morning. Thank you for joining me, Sangha, and my amazing co-host, Morton. It's our season 1, ninth episode, and we have none other than Professor Martin Green from Caring.
Martin, it's an immense pleasure to have you here. I remember probably at my very first day introducing myself and who I work for into the social care sector. You were among the speakers, and I remember how overwhelmed I was with how you're doing, what you are wanting to achieve for all of your members in Carrington. And while we're recording this now, we're actually on day 5 in Care Home Open Week, and I know that you've taken part in that. Can you say a bit more about what that is and what that means to you?
It's an initiative that started as Care Home Open Day and it's now gone into Care Home Open Week. And then throughout this week, I've been going to care homes and seeing the fantastic work they do, and also seeing how really welcoming people are and how pleased they are to be able to engage with their local area and their local community again after COVID. And one of the things I also find is when I talk to people who come into care homes for Care Home Open Week but have not really come before, they are absolutely amazed at the quality of people's lives, about the way in which care homes support people to live well. And one of the things that Care Home Open Week is fantastic at doing is dispelling the myths that are around about care homes. And we have a real opportunity here to champion our work. And I know so many care homes that have opened their doors and they get so much from the Care Home Open Week, but also the relationships they establish with local people go on into the future. And I think that's another really important part of this Open Week.
I absolutely second that, and actually it's put a lot of smiles on my face this week to see all these initiatives across social media, of course, and out in the real world, how welcoming and what an experience it is for people to visit care homes. And do you think that, fingers crossed, this can mean something going forward for instance, what could, with a terrible word, be described as the workforce crisis in this sector now?
Yeah, I think we have got a workforce crisis, as you quite rightly say. But I think opening our doors, getting people to understand what goes on in a care home, showing people the complexity, but also the joy and reward of the work is another way of really giving people an opportunity to say, this might be a job for me, this might be a career that I want to develop. And if you can engage in going into a care home, talking to residents, talking to other staff, it starts to seed in people a view whether or not they want to be involved in that work. So I do think that Care Home Open Week is really important in terms of establishing our careers in social care and getting people interested in careers in social care.
How are you seeing and thinking the future would look like with all this technology explosion that is happening outside the sector, but also as much within the sector?
Yeah, well, I think the issue about the workforce is our platform to understand that we need to do things differently. And one of the things that I think we need to do is embrace technology and also the collection of data far more effectively in the care sector. I've seen so many examples where relatively low-level technology can transform the life of the person living in the care home, enhance their independence, enable them to do more things for themselves, free up staff time to do the really important work of caring. And there are so many different types of technology. And I think that's the other thing. It's a field where there are lots of different things that can make a difference. There are also quite a few technological initiatives that are able to be implemented at relatively small cost. So I would urge every single care home operator to think about how they can use technology, first of all, to deliver better quality outcomes for residents, but secondly, to improve efficiency and to improve the quality of the work for the wonderful professional people who work in our sector. And I think there are lots of examples where that can be done.
Would you mind sharing some of the cool techs that you have come across?
I have to say, I find it really fascinating, and I've seen some amazing tech. So, for example, I went into a care home and there was some technology which was about pressure pads. So people then were able to know if a person had got out of bed. When they did get out of bed, a lovely tunnel of light directed them to their bathroom. And also, there was the potential for the staff to talk to the person if they didn't get back into bed to see if they were all right. Now, what was really interesting was when I was talking to one of the residents, he said to me, it's wonderful because he said they don't open the door every hour on the hour to see if I'm okay. And this then gave him much better sleep patterns. It also gave him much more confidence that if he wanted to get out of bed and sit in a chair and read a book, he knew that that he was able to talk to staff and say, "Look, I'm just reading a book. I'm okay." So there was that sort of technology. I've also seen some amazing technology which uses virtual reality in training and development. And this was a real eye opener for me because I was involved in testing that out. And I really felt that I was in the bathroom with the person living with dementia and the carer. I was able to also suggest the carer do some things, and then I was able to see through this virtual reality what response the person living with dementia had. But the reality of it was so amazing to me that I did feel I was in that bathroom. I did feel part of that interaction between a person living with dementia and a care professional. And I really found that absolutely fascinating. And I've seen this in terms of really practical outcomes and results. So I went into a care home and I met a man who was living with advanced dementia, and he had been into hospital 5 times in 7 months with urinary tract infections. They then fitted him with a small Fitbit, and this Fitbit showed changes in his temperature and changes in his mobility patterns. These were indicators that a UTI was starting. There was then proactive medicine put in, and that man never went to hospital again for the last 5 months of his life. That was good for him, it was good for the system. It was relatively low level technology, but it made a big, big difference. I've also seen some great examples of care planning technology. I've seen some fantastic examples of rotas being developed through technology. I've seen great use of technology where people can have more control over their work patterns, for example. So, these are a fantastic new initiatives that do make a difference. And of course, the other thing we must never forget is how important data is. And one of the few benefits of the pandemic was that our sector embraced getting more data into the system about what we do and the impacts of what we do. So in the future, I think if we combine technology with the development of data sets, I think this will deliver transformation in social care, and it will certainly put us on the front foot in the development of new initiatives. So I'm a great passionate fan of technology. I'm a passionate fan of the use of data, but it all must remind ourselves that it must not replace relationship-based care. But what it does do, it frees up staff to be able to deal with the really important issues of supporting people to live well.
Absolutely, and that's what Morton and I we keep saying. Technology and data, they are tools, but when you arm the people with those tools, magic happens. That's where the sector suddenly starts uplifting itself and becoming much more human, if I can say, because people are getting more time to be human.
Yeah, I totally agree. And I think we have begun a revolution, and it's hopefully a revolution that will end in a better place than where we started. And it's also one where I think care providers need to be in at the design and development stage. And one of the things that I often hear care providers tell me that they have a bit of software or they have a bit of technology, and it doesn't do exactly what they want it to do. And I always say to them, well, why don't you go back to the technology developer and tell them exactly what you want? Because one of the things I find when I meet people who are developing new tech is they are so good at solving problems. So if we as a sector tell them what we need, I'm absolutely confident they'll come up with the different systems that can deliver.
I'm really thrilled that you mentioned this aspect of working together, supplier provider, in achieving greater use of technology, because it's absolutely my sense that this is where we're going now. As I mentioned, when I came into the UK care sector 5 years ago, it was certainly not the landscape I was seeing. But today, I'm more than sensing how VR suppliers like Moonhub you've tested, and our own company Sangha, how we're doing stuff with our customers that I was unaware of people doing before. So, as a good example, we're working with one of your members down in Surrey to develop an AI that can help with exactly the UTIs and other stuff, to be preventative and to help predict what could go on in a certain person's life before it really happens. So we're allowing for time to be spent um, in the right places, and of course also to help support decision making, from a frontline care worker's perspective, because you can't know everything all the time, certainly not when you're on paper. So you're relying on that bit of data, and is that also how you're seeing your members collaborate more and more with the different suppliers?
Yeah, I mean, I think you're so right, Martin. It's happened quite quickly. So, and I would say over the last 3 to 5 years, what we've seen is a real seismic change in the way in which people are engaging with technology. And I particularly am pleased to see that it's now about a partnership with those who design and develop technology and those who are providing services. Because the more we can get together, the more we can develop more and more bespoke and appropriate uses of technology, and we can also do that problem solving thing. If we get together and we identify what the issues are, then I know that technology providers will be finding a solution. And it's that partnership that I think we've seen starting to develop, and I think that's something we should nurture into the future.
And I think that's one of the big silver lining, I would say, of COVID. So when I started my journey, I'm still a student of social care, and in front of you, Professor, I feel I'm in nursery, but I think there has been, like you say, a seismic shift with regards to collaboration. People are much more open to discussion, more open to experimenting, more open to trying things together rather than the siloed approach that was there even a few years ago.
Yeah, and I think the reality is we have some significant challenges, and we're never going to be able to solve them alone. So working together, either collaboratively with the people who supply and develop technology, or indeed, collaboratively as providers in through organisations like Care England, coming together, sharing our experiences, talking to one another about how we have met those challenges and what things have worked for us. That really helps the sector as a whole. And I have noticed that there is a real desire to position social care in a different way, and that requires us to be very collaborative. It requires collaboration between providers, it requires collaboration with commissioners, it requires a certain degree of integrated collaboration with the NHS, and of course with people who supply goods and services to our sector. Now, I'm seeing much more understanding of that matrix and how bits of the jigsaw fit together. And I think that's something we should develop and nurture into the future.
Certainly, when you just mentioned one of the key words, I think with collaboration, integrating health and social care data, what I'm seeing or in my work, it's certainly that the work that NHS Transformation Directorate is trying to put out now is encouraging another type of infrastructure that we've not seen before, at least when it comes to sharing data. I know we're not entirely there yet, but the openness to doing so means that we, in some years' time, will be able to see data properly flow between providers and their suppliers, of course, and into the NHS. So everything around discharges and around sharing information and so on will be much, much smoother, I'm sure.
Yeah, and ultimately that will lead to a better experience for people who use health and social care services. And we must always remind ourselves that our objective is to improve outcomes for people who use care services and health services, and we are here to enable them to live well. And anything that we can do using technology or indeed using data that helps them to have a better life, that needs to be our measure of success.
And with that regards, Professor, are there specific initiatives that Care England is, embarking on?
Yeah, I mean, one of the things that we're spending quite a lot of time on now is how we engage with the new integrated care systems at a local level, because these are our opportunity to shift the dial and to put social care very much at the centre, where we have a parity of both esteem and also understanding between health and social care. And what you do see is if you look at the lives of citizens. They don't sit in silos. They live their lives. They have health needs. They have social care needs. They have housing and support needs. And what we have to do is join those dots. Now, the way we can do that is through accessing data, through making sure our systems are able to talk to one another, being able to transfer information seamlessly across systems to the benefit of citizens and to the delivery of outcomes. There's also a lot of work that we're trying to do around measures of success. And I think that was another area that we were not very good at in social care. We were not good at identifying what good looked like, or indeed monitoring and measuring that. And I think we're doing far more work on that. We're particularly interested in some of the initiatives that are going on with bits of technology that might be helpful in training. And you mentioned Moon Hub, we mentioned that, but there are also some really great blended approaches to training and development, some of which might be internet based, some of which will be person to person based, some of which might be virtual reality based. These are things that will be transformational in our sector. And so we will constantly evolving and changing and developing. And Care England is very interested in thinking about the challenges of now, but also thinking about the challenges of the future. We are very clear as an organisation that there are really important immediate issues, but we do not want to have our eyes to the floor. We need to have our eyes to the horizon. We need to craft a vision for social care, and we as an organisation are committed to supporting our members and the rest of the wider system to deliver that vision.
Yeah, especially if we think of the really, really tough period we've just been through, there is certainly a risk to being too short-sighted. And and I know from having, of course, done lots of work with Care England Digital and with Daniel and that team, that you guys are very much on track. And what I'd really like to ask there is, how can your members come to you and get support on understanding their opportunities with regards to, yeah, going digital in a broader term?
Yeah, and as you mentioned, the work of Daniel Casson and also Louis Holmes, who've done a lot on the issues around digital. So what we hope that we will do is, first of all, transfer as much information out to our members, but also engage our members in that dialogue, which says, how do we make this happen for you? What can we do as a representative body to connect you to the right people? And we do have some really good partnerships which help our members to be directed to the right people. We also ask our members to tell us what the big blocks and challenges are, because we can work on those in a policy context to try and remove them. You mentioned the work that the NHS had done, and I really want to pay tribute to the people who were formerly in NHSX. They were so collaborative, they were so engaged in the social care bit of their agenda as well as the health bit. This was a really good example of a piece of the organisation that had a very clear remit, but knew that it was about the whole system, not about just one organisation. And what we're trying to do at Care England is broker those conversations, both nationally, regionally and locally. We are also doing quite a lot of work to help our members understand the integrated care systems in local areas and find ways in which they can engage with those new systems and have their voices heard at the table around planning and development. Some of that will be about technology. We have also called on the government to develop a technology and innovation fund for social care. And what I really would like the government to do is have that fund, but also have a lot of it about people putting forward ideas so that we could start to fund the very best of the best, and then think about how we make sure that we analyse the impacts and the outcomes and measure them. And if we think that things are working well, then we think, how do we replicate this across the system? So we're doing quite a lot of work around some of those sorts of issues. But I think in general, our position is, let's be on the front foot, let's be proactive, let's engage our members, let's think very holistically and broadly about who's in the partnership. So it's not only about health and social care commissioners or providers, but it's about the technology providers, it's about the data providers, it's about the data systems that will enable us to transfer information. It's about how we use the data when we've got it, what are the key messages for the system as a whole, and how we as a representative body can make sure those messages are delivered so that they become part of the system and the policy development. So I think Care England is trying to do a lot in this space quite proactively.
That they see you doing all the work you're describing here. So thank you for that.
Thank you, Professor. And we have very recently launched something called Data Cafe, which Daniel is very much part of, and we really want to bring in the data revolution, like you have been, sharing.
Yeah, and I really applaud you for doing some of those things around things like the data cafe, etc. Because what we need to do is demystify data and let people know that there are so many positives to collecting data. Some people have a narrative that data is all about control or Big Brother or whatever. Actually, data can be such a powerful and a positive force, and it can really make a difference to planning and developing services that make sure people get what they need and what they want. And I'm also very interested in how we use data to act in timely fashions that are more preventative, so that we're not going into situations where people are going into acute need. I want the data to tell us where the critical intervention points are that stop people going into dependency and maintain their independence and quality of life.
That's wonderful to hear from you, and that's such a big thing for the sector to understand that, when we are talking about data, it's not that you're reducing a person to a summation of observation. You are actually helping understand where you can bring in that preventive action so that the person at the end of the day gets benefit out of the whole process.
There's probably no better way to finish this episode, because that's really where you started, Martin, by saying that, in my words, of course, now then, technology is not about having some fancy tool at hand. It is about the people and those that we are all here for, and those smiles that we just talked about.
Thank you very much for giving me this opportunity, and I think we just all need to work together to deliver something better for the future.
Thank you for listening. Don't forget to subscribe, review, and share your favorite Take Care podcast with your friends and colleagues. Until we meet next week, take care.